As a kid, I can remember in the 50s playing ball on the property here. And I remember when ground was broken and seeing all the buildings go up.
I remember it being just a sleepy little community hospital, and it was very exciting when an occasional helicopter would be flying through.
When I first got here, if you had any serious diseases, you went downtown. But this hospital got serious about recruiting talent, and with that came a depth of capabilities which we never had before. We also became very interested in education, teaching students and residents.
This is a major teaching hospital, absolutely. That means there's a physician here 24/7 to see any patients, to keep in touch with them for anything, and I think that's essential.
The potential that we saw in Advocate Christ Medical Center is tremendous. When Ken Lucart joined Advocate, he created a vision to put Advocate Christ on the national map, and we've been realizing that vision.
One of his visions was to create these institutes. We used to live in silos, but the whole concept of the institute has synchronized us. We become a continuum of care. So there is a more fluent relationship between us.
Today, with the cooperative effort between cardiology and cardiac surgery, we work together side by side, delivering new therapies for less invasive interventions.
As far as growth goes, Ken Lucart totally changed this whole institution.
When you drive down 95th Street for the first time and see this campus, if you haven't been here in a while, it's just plain wow.
We have a new outpatient pavilion. We have this beautiful bed tower where patients can recover with great comfort. We have expansion of our operating room.
We added 3 parking garages, 2 bridges, and renovated almost 700,000 square feet in 56 months.
The outpatient pavilion is it's a beautiful place.
It's beautiful from the outside, but it's really a reflection of what's going on the inside.
Patients have loved it. The ease of getting in, the ease of seeing multiple different physicians in the same building has been really important. The new East Tower with the ICU care is fantastic, and I think it's been a big factor in better patient care.
We have the labor and delivery floor, we have a postpartum floor, and then those are all private beds. We traveled to look at other facilities around the country and to see what they designed and how's it working. What would they do differently? Today, we're in progress with the expansion of the emergency department.
The emergency room handles over 100,000 visits a year, and it was built for probably less than 30 or 40,000. This new remodeling and renovation that we're doing now will really take it over the top and get it to where it needs to be.
These 2 new buildings and this campus transformation that's going on is really solidifying our place in the Southland of Chicago to be the place for medical care.
Amazing things are happening. We're doing not just heart transplants, we're doing heart-lung transplants. In my world of stroke, people can come into a hospital paralyzed and unable to speak, and in an hour or 2 be normal based on our ability to open up blood vessels. It's breathtaking.
My primary physician noticed that my creatinine level was continuing to climb, and he said, your life expectancy is 85 years and your kidneys aren't going to make it that long.
If we don't do something, you're not going to be here probably in 2 to 3 years.
We have 4 daughters. They told my wife and I that they had decided to all be tested to see if they would potentially be a match.
And he was initially adamant against it, and we finally just said, this is how it's going to be done.
The daughters were very stubborn, and they all were tested.
We were all thrilled to find out that all 4 of us were initially the match, and it just made sense for me to step forward. It was Father's Day, and we checked in, and we got the ball rolling.
And then everything just kind of flowed, and I really had no fears at all. I feel terrific. My life is totally normal now, and I could think of no better place than to do it here with the Advocate Kidney Transplant team.
Transplant is such a gift, just to see their appreciation in their families. The transformation of their life is just incredible.
In February of 2013, I was diagnosed with congestive heart failure. They said, your heart function is down to 9%. The only way you're getting out of here is either with another heart or a mechanical pump. When Vicky's daughter had her accident, She goes, if there's anyone in this world that I would want to have her heart, is you.
I said, you're taking her heart. I said, I'm being selfish because that way, whenever I see you, I can hear my baby's heart. I can lay my head on your chest and hear my baby's heart.
When I woke up, there was this loud beating sound. And the nurse, she looked at me, she's like, that's your heart. I was like, I can live. I'm alive.
People arrive here and are saved, and what a wonderful thing to have right in our own backyard.
Congratulations, Advocate Christ Medical Center, on a wonderful journey and an amazing transformation.
On behalf of Jim Skogsberg and our entire Advocate senior leadership team, we want to express our deep gratitude for your tremendous support and generosity. It's because of your willingness to be a part of our organization that we've been able to expand and modernize the great healthcare that's being delivered at Advocate Christ Medical Center every day.
It could not have been done without the administration, and absolutely could not have been done without our physician partners.
The doctors, the nurses, and everyone who works at this place. It's a great place to be.
Our design consultants, our architects, our engineers, our general contractor and contractors, they brought us from what was on paper to a reality.
All the hard work and dedication is really paying off for us as physicians and for our patients.
It is a wonderful community resource. We are so proud and so appreciative that you have built this incredible facility for the whole Southland.
Our hospital is capable of doing virtually all that medicine has to offer. Miracles of medicine are lived in this place every day, and the word should go out. We're here. We're here on 95th Street.